Welcome to a deep dive focused entirely on some really cutting edge research, stuff that's shaping the future of medical imaging. Today, we're looking specifically at, well, a fascinating study published in Radiology Advances.
That's right. This study, led by a team including Etsuji Nakai, Yumi Miyagi, and Joseph R. Ledsam from Google Research in Japan, set out to answer a big question: whether artificial intelligence can serve as an effective second reader in screening mammography.
Right. This study, it feels like a potential game changer, doesn't it? Giving us a glimpse into how AI might fundamentally alter workflows in breast imaging. Our mission for this deep dive is to, well, cut through the details and get straight to the practical implications. So let's jump right in. What was the big problem this study was trying to tackle?
Screening mammography has really benefited from what's called double reading, where two radiologists independently review each scan to help catch more cancers and reduce misses.
Yeah, and that improves cancer detection compared to just one reader.
Exactly, which is fantastic for catching cancers earlier.
But there's a catch. It comes at a pretty big cost, basically doubling the workload. This study explored the idea of using AI as the second reader, a setup they call the AISR workflow.
Okay, so the idea being AI takes on that second read role, freeing up the human radiologist, but hopefully keeping that detection benefit we talked about.
That's the goal. They designed a retrospective study looking back at a data set from a Japanese screening center, covering 4,059 patients scanned between 2005 all the way through 2021. And they simulated this AISR workflow compared to its performance against their historical data using routine double reading. They even had junior and senior radiologists participate in a reader study as part of the simulation.
And importantly, you mentioned they noted the AI model wasn't originally trained on Japanese data.
That's a key point, yes. It was developed using US and UK data first, and then specifically fine-tuned on this Japanese dataset. Now, before we dive into the full AISR workflow results, it's probably worth asking, how did this AI perform just on its own? Looking at scans without a human partner.
Good question. What were the standalone AI results? How did it stack up?
Okay, so on the Japanese test set used in the study, the AI model achieved an area under the curve, an AUC of 0.84.
0.84. Okay, how should we interpret that number for breast cancer screening? What does that really tell us?
So, AUC is basically a single number that tells us how well a model can tell the difference between positive and negative cases across all possible thresholds. A perfect score would be 1.0. So, in this case, an AUC of 0.84? That's actually pretty solid, especially considering how challenging mammography interpretation can be.
They use JRADS, which functions much like the BIRAD system we use more widely, right?
Exactly, although there's one exception worth noting. In Japan, breast oncologists are also allowed to read mammograms, not just radiologists.
Were there any other sort of eye-catching numbers from that standalone test?
Yes, actually, and this is quite telling. When they compare the AI to individual human readers in the study, the AI significantly outperformed most of them in terms of specificity at a matched sensitivity.
Okay, hang on, break that down.
Right. So think about it. The AI was better at not flagging things that weren't cancer, while still detecting the same proportion of actual cancers as the humans did. Plus, it was also notably better at pinpointing the location of potential lesions. It showed a sensitivity of zero point 0.8 compared to the average human reader's zero point 0.6 for just localization.
Wow. So on its own, the AI showed some seriously strong performance. And what's really impressive is that it still did well even when tested on data from a completely different population after that fine-tuning step. That kind of adaptability is huge. I mean, that's one of the biggest challenges when it comes to deploying AI across different healthcare systems around the world, right?
Agreed. The ability to generalize or at least be effectively fine-tuned, it's critical for real-world application. It suggests this technology isn't just limited to populations that look exactly like the training data.
All right. So yeah, the standalone AI looks promising, no doubt. But the real test, and really the heart of this study, is how it performs in the actual workflow. So, how did the AI as a second reader setup stack up against the usual double reading by two human radiologists?
Yeah, this is really the key takeaway. In the simulated AI workflow, where a junior radiologist reviewed the scan first, followed by the AI's input, they actually saw a statistically significant boost in sensitivity, We're talking about a 7.6% improvement compared to standard double reading by two human radiologists. However, there was a trade-off, as you often see in these scenarios.
Ah, okay. What was the trade-off?
They observed a statistically significant decrease in specificity by 3.4% in the AI arm.
What about that initial problem, the workload? Did the ASIR workflow actually deliver on reducing the human burden?
Absolutely. And this is one of the most striking results, I think. In the reader study portion, a remarkable 71% of cases, that's 212 out of 298, did not require review by a human senior reader when AI was used as the second reader.
71%.
Yep. Basically, the AI and the junior reader agreed so the case could theoretically be cleared without that extra senior review.
Wow. I mean, this really speaks to a future where a significant chunk of routine workload might be handled by AI, freeing up human expertise for the more complex, challenging, or maybe discrepant cases.
Precisely. Now, a crucial point in the AISR workflow was the arbitration step.
Right. What happens when they don't agree?
A senior radiologist had to step in to make the final call.
Hmm. And what did they find there?
Well, the study found that the senior readers agreed with the junior reader more often, about 63% of the time, than they did with the AI, which was about 37%.
Huh. That's interesting.
And the study noted a subtle but important trend in these disagreements. Interestingly, when the senior radiologist agreed with the junior reader, it was actually a bit more likely to lead to a false negative. On the flip side, when the senior sided with the AI, the outcome was slightly more likely to be a false positive.
So the study also looked at another angle, didn't it? How did having the AI available impact the individual junior readers, just their performance?
Yeah, they looked into that too. What they found was that junior readers became more consistent in their decisions when they had AI support. But interestingly, their individual sensitivity and specificity didn't really change much compared to when they were reading on their own.
So the AI helped them align their decisions, maybe be more uniform, but didn't necessarily make them individually better at detecting or ruling out cancer on their own.
That seems to be the takeaway, yeah.
But did it impact their efficiency, their speed?
Oh, yes, dramatically. The average reporting time per case for junior readers was cut by more than half. It went from 2.2 minutes without AI assistance down to just 1.4 minutes with it.
That's a significant gain in throughput, especially in a busy screening environment.
It really is. So if we connect these findings, to the bigger picture, this study provides pretty strong evidence that AI may serve as a highly effective second reader.
Seems like it.
It may significantly reduce the workload burden on experienced radiologists, potentially increase cancer detection rates, and improve consistency across reads. Plus, the time savings for junior readers also point to potential efficiency gains at the individual level.
However, those results around individual performance and the arbitration step, they also underscore that just providing the AI result isn't some kind of magic bullet, right? It's about how the human reader interacts with that information.
Exactly. It suggests that effective integration of AI might require, well, training or guidance on how to best leverage the AI's input, particularly in complex or ambiguous cases. It's not just about presenting a score or a recommendation and walking away.
What were some of the limitations the authors themselves noted? And I guess how applicable are these findings to different settings, maybe outside of Japan?
Yeah, the authors were quite clear about the study's context. First, it was retrospective, which always limits causal conclusions.
Right, and you also mentioned the readers were from a well-resourced center where ultrasound is often used alongside mammography in the screening workup.
That's correct. And that isn't standard practice everywhere.
So all these factors, the retrospective nature, the specific population, the local practices like using ultrasound, suggest results might not directly translate to all populations or all healthcare settings without more validation.
Yes, exactly.
These findings are exciting, definitely, but maybe not a universal guarantee without local testing.
Precisely. The need for prospective studies in diverse settings remains really high.
Well, this deep dive into the Radiology Advances study by Nakai, Leadsome, and their team, it's been incredibly insightful. It really underscores that AI as a second reader isn't just theoretical anymore. It's a tangible technology showing real promise.
Yeah, this study really lays out a compelling model for how AI could help address some of the major challenges in breast cancer screening. The potential gains in detection, reduced workload, and better consistency could make a real difference for patient care and the long-term sustainability of screening programs. It's definitely an evolving landscape, and honestly, learning how to work with these powerful tools might end up being just as important as mastering image interpretation itself.
Thanks to Etsuji Nakai, Yumi Miyagi, Joseph Ledsum, and colleagues for this important contribution on AI as a second reader in breast cancer screening. If you enjoyed this episode, don't forget to rate, review, and subscribe. It helps others discover the show and supports our mission to highlight impactful research. You can read this article and explore more at Radiology Advances on the journal's website. This episode was generated with the help of AI, but all content was reviewed and fact-checked by a human editor to ensure accuracy. Thanks for listening. We'll see you next time.